Hello, it's Vanessa from the Vet Station. I'm the lead surgeon here and I've just put together this informational video for you on laparoscopic spays in pets. This is also known as keyhole spay, and the reason that it's called this is because of the size of the incisions that are made in order to perform the spay. Traditionally, before we had this equipment and this technology, we would perform spays by making a large incision in the abdomen, moving aside the organs, fishing out the uterus and the ovaries. Surgery has progressed a long time since then, and following on from our counterparts in human medicine, we are now performing procedures more and more via the laparoscopic methods. In this case, for a spay, we would remove the ovaries only. It's not necessary to remove the uterus, and we would do so by making two tiny incisions in the abdomen. We're able to do this because the instruments that we use are very small. We can do this in a very precision, accurate way. We don't need to interfere with the other organs because the way that we position your pet means that we can directly target the ovary. In a traditional spay, you're going to need to go in there, snap ligaments and pull that ovary out, tie ligatures and then remove the ovary. It's quite brutal, it causes a lot of damaging and it causes a lot of pain. With laparoscopy, we can take the ovary from where it is. We use cautery to remove it, so there's very minimal risk of bleeding. With the ligatures, they can slip, we can have bleeding. With cautery, there's very low risk. And then we can remove just what's needed and pull them out through the tiny holes. The holes are so small that the risk of wound breakdown, herniation and infection is reduced significantly when compared to the traditional open spay. It's very rare to get one of these complications from a laparoscopic spay or keyhole spay. Recovery time, whilst it is the same number of days as an open spay, just comes with a lot less pain and a lot less risk. So we're going to ask you to rest your pet for 10 to 14 days after the spay, but that is just to make sure those muscles knit together properly and we get a lot of healing. But like I said, there's going to be very low risk of complications during that time. I'm often asked if the length of anesthesia is longer for a laparoscopic spay. I've been fortunate enough that I learned how to do these very early on in my career, and so I've more than 15 years experience, and I can say that it's quicker for me to do a laparoscopic spay than an open spay. I find the equipment very easy to use. You know, we've done so many of them. The setup, everything is very quick here, and so there's no risk of extended anesthesia time in comparison to an open spay. Your pet will be in for the day, so there's no extended hospitalization period either. In fact, what I find is that the pets that have laparoscopic spays are able to go home very quickly after surgery because they recover so well. They're very comfortable. They eat their food, they're up and they go out for toilet, etc. very quickly after surgery. And that means that we are happy to send them home so that they can be in the environment that they know with their family and be much more comfortable for a recovery at home. We will of course perform a full clinical examination of your pet prior to surgery to make sure that there's no issues. And it's, like I said, it's a day procedure, so in and out. We also will include post-operative checks that of course are included when you come in for everything, because we want to make sure everything's recovering. It's usually 2 to 3 days after surgery and 10 to 14 days afterwards we'll do some checks, and at that final check, if everything is fine, then your pet will be signed off. There are of course incisions we want to mind, so we still need some way of preventing licking. Licking can cause infection and wound breakdown, so you'll be given an option of a pet t-shirt or a collar to come home with, and will provide pain relief for a few days. Although they're not as painful as a traditional spay, we still want to provide pain relief because the surgery has still been performed. Unfortunately, we will need to clip some fur off your pet, so there may be a large clip patch over the abdomen and a little one in the arm where we place the IV line in order to have access to give pain relief and anaesthetic medications. I'm going to show you some of the equipment so that you can see what it looks like when we perform a laparoscopic spay. So these are some of the instruments that we will use in order to perform the laparoscopic spay. These are trocars, so we'll need one of each. So one of these and one of these that we'll insert into the abdomen and inflate the abdomen with carbon dioxide in order to space it out and give us room to operate. This is an example of one of the graspers that we will use in order to pick up the ovaries. And if I put my finger next to it, you can see how tiny that instrument is. The other thing I've got out to show you is the vessel sealer. So this is what we will use to ligate the vessels and make it safe to remove the ovary. It's in a surgical pack, so we'll just remove that. You can see it's 5 millimeters, so this is tiny, 0.5 centimeter in size. And here's the tip here, so we'd be able to cauterize and cut the ovary away and remove that safely through the ports there. I hope that video was informative for you. If you have any questions, have some comments below, or send us an email if you're watching this on the website. Remember, if you are a member of our fire plan, then you will receive 20% off, as well as unlimited veterinary consultations. So if this is of interest to you, please have a look on our website where you'll find more information about laparoscopic spays and about our well-known and popular fire plan membership.